Hello, everyone. We're going to be talking about Reye syndrome, a rare condition. It is that affects mainly children and is caused by swelling of the liver or the brain. And it can also cause fatty infiltration to other organs, but the liver and the brain is where it's affected mainly. And the etiology is unknown, but it usually follows recovery from a viral illness such as chickenpox or the flu, and has been seen a lot if children are given salicylic containing compounds such as aspirin, Pepto-Bismol, Alka-Seltzer, and uh, it basically causes the mitochondria to function abnormally. So a lot of the risk factors, children, anyone under the age of 18, use of any salicylic containing compounds, a viral illness, like said earlier, chicken pox or the flu. And then also they found that people living in suburban or rural areas, and that's possibly due to the exposure to pesticides. And it's a rare condition, but in order to successfully treat and manage it, it needs to be diagnosed early and treated aggressively, and being as supportive as possible to the family and to the parents. For the treatment, well, signs and symptoms. They've actually divided the symptoms, signs and symptoms into different stages of the disease, and it's based off acuity. So stage 1, you'll start to notice that the child becomes sleepy, lethargic, and can start vomiting. Stage 2, they're a little more irritable, restless, positive Babinski sign, which we all know about, confused, and can be combative as well. Stage 3 they can have a coma, and they'll show decorticate rigidity, whereas in stage 4, they'll show decerebrate rigidity. They'll also have fixed dilated pupils, loss of oculovestibular reflexes, and can start having seizures as well. And then stage 5, they can have paralysis, loss of their deep tendon reflexes, and even respiratory arrest. So like I said earlier, the best thing to do is to find and treat this disease as early as possible. Some of the diagnostic studies in labs for blood chemistry, you'll see an elevation in the ammonia levels, the BUN, the creatinine, and also can see hypoglycemia. If you do a liver function test, you can see the AST and ALT levels elevated, as well as the lipase and amylase levels. And you can see a prolonged PT and PTT. Liver biopsy is one of the best tests that can be done too. It'll show fatty infiltration, and a CT scan, MRI can be done to check for cerebral edema, which along with it can cause an increase in the cranial pressure and cerebral spinal fluid. And so a lumbar puncture can be done as well to determine the increased CSF pressure. In order to treat the disease, you kind of treat it as an emergency. So any signs or symptoms that present, you'll treat. If they're hypoglycemic, you're going to give them dextrose. If they're having a seizure or in respiratory distress, you'll give them prescribed oxygen. You can give them diuretics to reduce the intracranial pressure. If they're having a seizure, you can give them phenytoin for the seizures, anticonvulsive medication. And then to reduce febrile edema, you can give them dexamethasone. For treatment, the best thing, you want to optimize their physiological function and reduce the risk for any complications. So keeping the head elevated will decrease the intracranial pressure. Always monitor vital signs and mental status. As stated earlier, mental status is kind of one of the first signs that you can notice as far as if they're altered or, start acting a little different. So really listen to the parents if they're saying, my kid isn't acting right. And you can maintain electrolytes with IV fluids, monitor for seizures and assess for fall risk. And also you can monitor the ABGs and notify any abnormalities. And EKGs as well. Sometimes abnormalities in the heart rhythms can be seen. depending on the stage. For patient and family teaching, one of the most important things is never give aspirin to anyone under the age of 20, and avoid giving any over-the-counter salicylate containing compounds, which some parents aren't aware of, which is Pepto-Bismol and Alka-Seltzer, stuff like that. Always monitor the child for changes in their behavior and their level of alertness. You're going to discuss the potential complications and risk and benefits, and just keep communication open with the family and support them any way you can if they have given them, aspirin or anything under the age of 20, to discuss any potential risks that they could be dealing with in the future. And like I said earlier, early diagnosis and aggressive supportive therapy is the most important aspect to successfully treating the disease. And about 90% of children affected by Reye syndrome are successfully treated and okay, and another 10% can see some brain abnormalities or problems because of it, and even death. So early diagnosis and aggressive supportive therapy is the best treatment. And that is Reye's syndrome.